Hi, everyone. My name is Dr. Taylor Hall, and I'm an assistant professor in the School of Social Work at Bridgewater State University. And today I am going to be talking to you about utilizing SBIRT, which stands for Screening, Brief Intervention, and Referral to Treatment in social work settings. So I'll be sharing some case examples with you via video. I'll be showing you an SBIRT toolkit that you have available to you as a Massachusetts or Rhode Island resident, somewhere local. And I'll also be talking a little bit about alcohol use disorder, substance use disorder, the history of SBIRT, why we even use this as a prevention tool, the different measurements that we use as part of SBIRT, and really thinking about why this would be a helpful tool for social workers in settings, specifically when we're thinking about being able to be more equipped, right, to work with folks who may exhibit symptoms that are related to a substance use disorder or an alcohol use disorder in the field. Okay, so that being said, I am going to share my screen with you here. And here we are, utilizing SBIRT, Screening, Brief Intervention, and Referral to Treatment in Social Work Settings. So some of the learning objectives for this comes from Competency 4 and Competency 6. So we are going to be using and translating this research evidence that comes from SBIRT to improve and inform practice, policy, and service delivery. So again, this skill, this intervention tool is helpful for us to really set folks up to start to think about maybe I do engage in problem drinking, or maybe I do engage in problem substance use, and briefly sort of intervene in these settings and then refer them out to treatment and services. And additionally, we're going to be using this training to help us figure out if SBIRT is something that's an appropriate intervention strategy based on our assessment, our research knowledge, but also our values and our preference of clients and constituencies. So one of the things, I guess I'll go back first, one of the things that really led me to think about this as something that could be useful for us is that the American Academy of Social Work and Social Welfare created what's called the Grand Challenges for Social Work. And it really has highlighted the importance of social workers specifically addressing substance and alcohol misuse to advance social justice and well-being for clients, communities, families, all of the above. Addressing the training and educational needs then of social workers to promote competence within this practice area of alcohol and substance misuse is a crucial step in improving the well-being of the folks that we do serve. So I did just kind of want to start out and give some definitions here of what we're talking about in terms of what an alcohol use disorder is and what a substance use disorder is. So an alcohol use disorder is a chronic relapsing brain disease that's characterized by an impaired ability to stop or control alcohol use despite adverse social, occupational, or health consequences. And an alcohol use disorder can range from a mild disorder to something that's more severe. A substance use disorder, and this is interesting too, because alcohol is a substance, right? But we have a separate category for alcohol use versus other substance use because of the historic sort of separation of alcohol from other drugs. That's a conversation for another time. But a substance use disorder is a condition in which the use of one or more substances leads to a clinically significant impairment or distress. So substance use disorders are characterized by an array of mental, physical, and behavioral symptoms that may cause problems related to loss of control, strain to one's interpersonal life, hazardous use tolerance, and withdrawal. So I wanted to share with you some data here on alcohol use disorder and substance use disorder. So in terms of the prevalence of drinking, according to the most recent national survey on drug use and health, about 86.3% of people ages 18 or older reported that they drank alcohol at some point in their lifetime. So 70% had reported that they were drinking within the last year, and 55.3% reported that they drank in the last month. In terms of binge drinking and heavy alcohol use, so binge drinking for folks who identify as women would be 4 or more drinks in one setting. for those who identify as male, 5 or more drinks in one setting, and heavy alcohol use is doing this more than 4 times a month. So essentially, if you are binge drinking every weekend, then you are considered to be a heavy alcohol user. So in 2018, 26.45% of folks ages 18 or older reported that they did indeed engage in binge drinking in the last month, and 6.6 report that they engage in heavy alcohol use lately. In terms of a substance use disorder, in 2018, approximately 20.3 million people ages 12 or older had a substance use disorder related to their use of alcohol or illicit drugs in the last year, including almost 15 million who had an alcohol use disorder and a little over 8 million with an illicit drug use disorder. As far as the data show, the most common illicit drug use disorder was marijuana, and that's at 4.4 million people. And so the percentage of people ages 12 or older in 2018 who had used marijuana in the past year was just about 16%. And that's higher than the percentages from 2002 all the way up to 2017. So we are seeing an increase in marijuana use disorder. And this could be more people are sort of having access due to legality in different states. This could be that more people are talking about or feeling like there's less stigma around overuse of marijuana, things like that. Prescription pain reliever misuse was the second most common form of illicit drug use in the United States in 2018, with 3.6% of the population misusing pain relievers. So that's an estimated 2 million people that do indeed have an opioid use disorder, which includes 1.7 million people with a prescription pain reliever use disorder and about 500,000 people with a heroin use disorder specifically. All right. So let's start by understanding what is SBIRT. SBIRT is screening, brief intervention, and referral to treatment. This is a comprehensive and integrated approach to the delivery of what's considered to be an early intervention and treatment service, which uses a universal screening for persons with substance use disorders and those who might actually be at risk for developing a substance use disorder. This began in the 1980s, where the World Health Organization in the United States started to work together to provide evidence for both alcohol screening and brief intervention in primarily in healthcare settings. Since that time, there's been more than 100 clinical trials that were conducted to evaluate the efficacy and cost effectiveness of alcohol screening and brief intervention in primary care, emergency room departments, as well as trauma care centers. So the screening, again, has been primarily set up in healthcare centers and helps healthcare professionals in particular identify and help people whose drinking or substance use might cause or complicate medical and mental health functioning. So in 2003, this is where we actually see that SAMHSA develops SBIRT as a model and starts to test whether this would be an evidence-based practice for substance use disorder prevention, okay? So we're gonna go through, sort of why this is important. We're gonna be thinking about some case examples again, going through our toolkit and learning what makes up SBIRT. So in terms of its importance for us as social workers, alcohol misuse and substance use are highly relevant for us in providing service to all populations, and this includes individuals, families, and communities. You could be a social worker that specializes in a substance misuse setting, but you also might be encountering acute or chronic substance use as a contributing factor to many of your clients' presenting issues when working in a variety of other settings, including health and mental health care, child welfare, services for those who are our elders, criminal justice, correctional facilities, employee assistance programs, or even in your private practice. Because of that, we kind of feel it's imperative that all social workers, regardless of your primary practice setting, be trained in recognizing substance misuse and be given the tools and the skills to provide basic but crucial screenings and evaluation. So given that social work uses a biopsychosocial framing to understand clients and address problems, the combination of these factors associated with alcohol misuse. So, right, biological vulnerability, sensation seeking, peer influences is particularly well suited for a social work intervention. So again, screening, brief intervention, and referral to treatment is an evidence-based approach to identify risky levels of alcohol and other drug use. And again, the big goal here is to reduce and prevent any kind of related health consequences, so disease, accidents, injuries. So in order for us to do that, we have to be able to identify the at-risk substance use that's helping to prevent then more serious diseases like addiction, similar to how we do other preventative screenings for things like cancer, diabetes, or hypertension. Again, addiction is a disease, so we need to start sort of treating it as a disease in those similar ways. Both SAMHSA, the Substance Abuse Mental Health Services Administration, and CSWE, the Council on Social Work Education, really have started to encourage social work in particular to adopt this SBIRT framework, supporting that this is something that is part of a long-term system change that we really need to adhere to. So this SBIRT process is comprised of three primary areas, and the first is pre-screening for alcohol and other drug use, and this is completed as part of typical intake and routine assessment forms. The screening process is intended to assess the severity of a person's substance misuse and identify the appropriate level of care or next steps. So screening can be completed in various community settings, and it really only requires a limited amount of experience in this training, and we'll go over the forms in a little bit. If the screening does indicate moderate risk behaviors, then the second step is to complete a brief intervention. So much of SBIRT is based in MI or motivational interviewing. This brief intervention really aims to increase insight and awareness regarding substance use, and really wants to push this person to start to feel that motivation internally to change these risky behaviors. So this step usually takes about 15 minutes to complete and assumes that you have some training in MI techniques and a foundational knowledge at least of substance use. Finally, if the screening results indicate high-risk behaviors, then a referral to treatment or more intensive specialty care is generally recommended. All right. So I just wanted to include some interesting statistics here that we've found based on SBIRT screenings. So combined national data that started to be collected in 2008 and ended data collection in 2014 showed that an annual average of 8.7% of full-time workers age 18 to 64 used alcohol heavily in the last month, 8.6% used illicit drugs in the last month, and 9.5% were dependent on or misusing alcohol or illicit drugs in the last year. That the highest rates of past month activity in substance use came for heavy alcohol use among full-time workers ages 18 to 64 were found in the mining industry at 17.5% and the construction industry at 16.5%. In terms of the highest rates of past month illicit drug use, that we saw that in folks who worked in accommodations and food services industry at 19.1%. So workers in the accommodations and food services industry, again, had the highest rates of past year substance use disorder. So we do see that there are clusters sometimes based on place of work. In terms of outcomes, this is really interesting data as well, that there was a large-scale study, again, across a number of years with a baseline and a 6-month follow-up. So out of 754,525 adult patients, 171,921 screened positive for hazardous or harmful use and were recommended to a brief intervention. And that is just about 25%, okay? Of that number, of that 171,000, 17,575 individuals held valid baseline and follow-up interviews, which means we were able to measure their symptoms at baseline, so when they first come in for services, and again at 6 months to see, is this SBIRT prevention actually helping people sort of think about their risky substance use behaviors and perhaps get into treatment. So in terms of what the sample of this study looked like, they were middle-aged. So the mean age was 37.5 years old. They were much more likely to be male than female. They were primarily white, followed by Black or Hispanic, and approximately 60% were high school graduates. So you know, a large number of folks as well were seeing that there is a correlation or a relationship with education and substance use. So the results after these 6 months was that the prevalence of alcohol use was actually lowered by 35.6%, heavy drinking by 43.4%, and illicit drug use by 75.8%. So greater intervention intensity was associated with larger decreases in substance use. So say you're screened in, you are going to get more assistance, more treatment, more resources, and for folks who sort of took it upon themselves or was able to connect to those resources, they had the greatest decreases in substance use. So we do know this process of screening, briefly intervening, starting to get people to think about their own substance use, think about the risks that they're taking and the issues that it might be causing them in their lives, and then referring them to treatment and resources is definitely decreasing the level of substance use in these populations. Okay, so I did want to check out the SBIRT Clinicians Toolkit for you online and explain a little bit about what that looks like. I have mine here, so you can get an in-person copy if you want. This is called SBIRT. So this is the Massachusetts SBIRT training manual and plan. Everything that I'm about to show you on a web page is included in this trainer's manual. And this is given out to you by the Bureau of Substance Addiction Services, which was formerly known as the Bureau of Substance Abuse Services. But again, when thinking about stigmatizing language, BSAS is what they're called, ended up changing their name. So the link is here on your screen. For you to check out your own toolkit. Again, you can print it out, or you can actually request one through the Bureau of Substance Addiction Services. So I'm going to stop sharing my screen just for a minute so that I can reshare with you a different link. All right. Let's see. Where are we? Perfect. Okay, so this is what I was trying to share with you. This is the clinician's toolkit, same thing that I have. And so this is a step-by-step guide on how to utilize SBIRT. So SBIRT is a recognized evidence-based intervention for reducing the risk of alcohol in the general population, and it is now included in SAMHSA's registry of evidence-based programs and practices. So SBIRT is a public health approach that was designed to universally screen people in a variety of medical settings, such as primary care settings, trauma centers, emergency rooms, as I said, but this has now been used more widespread in the criminal justice system, in education programs, and places where social workers work, right? Because social workers obviously can benefit from this model quite a bit. Traditionally, we sort of used to think that you'd have to be working in an addiction center as a social worker to be able to learn and apply these screening and intervention techniques. However, SBIRT really represents a paradigm shift in social work, which integrates this universal screening from a public health model and connects these universal social work skills that we have with SBIRT techniques. So we have our motivational interviewing. That really allow us as a social worker to help guide the client in behavioral change to prevent the occurrence of more severe and debilitating substance-related conditions and consequences. So we'll go through this a little bit. I want to talk to you about what is included in this SBIRT model. So essentially, there's a table of contents that will explain to you where this goes. So this initially talks about the screening, brief intervention, and referral to treatment. So about 75 to 80%, 85% of patients will screen negative. We're going to see two cases, one of a positive screen and a negative screen in a moment. And so about 5% of the people who are screened initially will actually be referred to treatment based on the fact that they are ready and open to that message, essentially. In this toolkit, there's also information that I shared earlier in this presentation in terms of what is considered to be risky drinking, binge drinking, heavy drinking, based on if you identify as male or female. Some information here on why we should do this, what we need to do to be prepared to do this. And then we get to this piece here, SBIRT in action, which gives us exactly what we're going to be using. So we start off with the audit, and the audit stands for the Alcohol Use Disorders Identification Test, and it's an alcohol screen that can help identify patients who are hazardous drinkers or have active alcohol use disorders, including alcohol misuse and dependence. It's scaled typically on a score of 0 to 12, and a score of 0 reflects no alcohol use. In men, as you're seeing right here on your screen, a score of 4 or more is considered to be positive, and for women, a score of 3 or more is considered positive. So generally, the higher audit score you have, the more likely it is that your drinking is impacting your health and safety. So that's the first step, is to screen for alcohol use. And then we move to the DAST, which stands for the Drug Abuse Screen Test. And this is designed to provide a brief self-report for screening to see if the degree of consequences for substance use. So for both men and women, if your score is greater than 1, then you have at least risky drug use. So then you're able to move on, okay? And so this goes further into the audit C, which again is 10 questions. So you are able to answer more of those. We have further diagnostic evaluation here where we can see, as these scores start to add up, is this person, does this person need to have a brief intervention? This is still part of the screen and assess piece. Here's that DAST as well in terms of risky substance use. So you see, as your client screens positive for these different steps, you're going to move forward with asking more questions. Obviously, if they screen negative, then you don't move forward, right? So we see the scoring here. If you are scoring less than 3, it's risky use. But if you're scoring higher than 3, then you want to go to the next step, which is the brief intervention. So at this point, we start to ask a little bit more and assess for severity using the CAGE. And the CAGE is a series of 4 questions that we use to check for signs of possible dependency. And CAGE stands for cut, annoyed, guilty, eye opener, which are part of the questions here. So again, if you have higher than a 1, whether you're male or female, you are going to be screened in for that brief intervention. And the brief intervention piece here is the motivational interviewing, right? Where you start to understand your patient's views, you start to give them some information or feedback on what it is that they've been telling you about their substance use. We start to enhance the motivation for change. So you want to ask here about readiness and the confidence scale. Sorry about that. And at that point, you want to give advice and start to negotiate the goal. So what is it that this person's going to be looking for, right? You summarize what it is, ask them if it's accurate, do you want to stay healthy and safe? And then you move forward from that to the referral to treatment. And this guide, which again is all what you're seeing on your screen here, gives you information about where in Massachusetts and where sort of outside of Massachusetts as well, you can refer people to treatment. Okay, so that's our SBIRT tool. So at this point, let me go back to my PowerPoint. I wanted to show you some case examples. So we're going to start with a negative screen example and a positive screen example. And then during this time, I want you to be thinking about, what did you notice about these role play examples, right? What was done well? What would you reconsider for next time? And really think back to those competencies about really being able to assess your clients, really being able to take these reliable, valid scales, so the audit, the DAST, and the CAGE, to really work through what a client is experiencing, okay? So we're gonna watch those 2 examples. and then we will wrap up. Okay, so we're back on this screen and we need to go here. Okay, so first we're going to watch an example of a negative screen for substance use using SBIRT.
Okay, Ms. Wright, we've reviewed the medications you take. Now I just want to ask you a few more questions. Have you ever smoked even a few cigarettes in your life?
No, I mean, I tried one when I was in my teens, I think, but I didn't like it. Yeah.
Okay, great. How about with alcohol? How often would you say you have a drink of alcohol, including beer or wine, in the past year?
Once or twice a month. So, I mean, really not often. I don't love the taste.
Okay. And when you do drink, how many drinks will you typically have?
One, maybe two. If it's white wine. I like wine.
Okay. Now, ever in the past year had 4 or more drinks at a given time?
No, that would probably kill me. I'd feel too out of control.
Okay.
Yeah.
Great. Okay. Now I want to ask you about prescription medications. Have you ever taken someone else's prescription medicine?
No one else's.
Okay.
Yeah, just things that were prescribed to me. I mean, I've been prescribed things over the years, but.
Okay. Have you ever, with the things you were prescribed, ever taken them in ways that they weren't prescribed?
No, again, it makes me nervous to sort of get out of control with medications or alcohol, things like that. So, yeah.
Okay. Ever take it to get a feeling from the medication?
No, I guess I'm not that adventurous.
No?
So.
Good. Good. And how about other drugs? Ever try marijuana, heroin, cocaine, LSD?
No. I mean, some of my friends smoke marijuana, but.
Okay. Never even tried it though?
No, I wasn't really that interested. Cigarette was enough for me.
Okay,
so
great.
Okay, so that was an example of a negative screen, obviously. The client here did not signal that she was engaged in any kind of substance use. So now we're going to watch a positive screen for substance use using the SBIRT model.
Drink Budweiser.
Okay.
Mm-hmm.
So, Ms. Hirsch, we reviewed some general kind of health habits around your diet, exercise, sleep. Want to ask you a few more questions now. Have you ever smoked more than a few cigarettes in your life?
I did smoke a pack a day, late teens and 20s, but I haven't smoked in many years now.
Okay, nothing at all in the past 30
No,
days?
not even a puff. I found that was a problem, so
okay.
I was able to quit smoking. So I'm really happy I did that.
Good.
Yeah.
Okay. Now, how about alcohol? In the past year, how often would you have a drink, even beer, wine, any alcohol at all?
I drink about 3 to 4 times a week. Definitely on the weekends, and then a couple times during the week I go out.
Okay. So you say a couple, how many?
Probably 4 is an average, 4. 3 to 4
times in a week? Okay. And when you do drink, how many drinks will you typically have?
Usually a pint or two. You know, when I go to the bar and maybe when I have people over.
Okay. A pint of
a beer. I like beer. I drink Bud or might splurge for Corona every now and then, but usually I drink Budweiser.
Okay. Great. And how about any times in the past year where you've drank 4 or more drinks in one occasion?
There were a couple, I guess, celebrating a promotion and celebrating, let's see, somebody's birthday. I drank a little more than that.
Okay. So
yep.
A couple times, you'd say?
2 or 3 times during the year I drank more than that.
Okay.
Yep.
So usually under that amount?
Usually under that amount, correct.
Okay.
Yep.
Okay. Now I just want to ask you a little bit about prescription medications.
Okay.
Ever take any prescription medicines that weren't prescribed to you?
No, I haven't done that.
Okay. Ever or anything?
Never.
No. Okay. Prescribed like pain medicines in the past?
I had a couple of root canals, I guess, over the last 5 years, and I have been prescribed Percocet. But I take one or two. I really didn't care for them, so I have taken them, but it's on a rare occasion.
Ever take them in a way that wasn't prescribed more than you were supposed to?
No.
No. Ever take them to kind of get a different feeling from them, or to help you, like the Percocets are for pain, but take them to help you go to sleep?
No, didn't know.
Never? Okay, great. How about other kinds of drugs? Ever even try marijuana, heroin, cocaine, LSD?
Well, I occasionally smoked marijuana as a late teen, early 20s, but I haven't smoked marijuana in many, many years. It was more like experimental type of stuff, but it really wasn't a steady user. So I haven't smoked marijuana in many years.
Okay. And other than the marijuana, any other?
Oh,
drugs
no,
like
no
that?
cocaine or heroin, I think you said, or LSD. No, none of those.
Nothing. Okay, great.
Okay. So there you have it of how that initial screening tends to work using the SBIRT model. You're seeing that this person is,
Smith, your cat.
sorry about that, that this person is a doctor, and that they are probing, right? They're asking these questions. They're adhering to the script that's provided to you as part of the SBIRT model, and then they are going to act accordingly based on the client's answers. So in summary here, SBIRT is obviously a comprehensive integrated public health approach that helps us as social workers deliver an early intervention and treatment service for folks who may be at risk for developing a substance use disorder, those that already have a substance use disorder. So this is something that can be used in any social work setting as well as medical settings. And again, that first step is the screening, and the screening quickly assesses the severity of substance use and identifies the appropriate level of treatment. If your client does screen positive for risky substance use, then we move forward to the brief intervention, which focuses on increasing insight and awareness regarding substance use and motivation towards behavioral change, again, utilizing those MI techniques and skills. And lastly, if this person is ready, right, we're meeting clients where they're at, then we can refer them to treatment, to more extensive treatment or to access specialty care, again, depending on what's best for that client. So in summary, the SBIRT model has been proven effective in early intervention and the treatment of substance misuse. This is, again, part of one of the grand challenges of social work, to respond to alcohol and substance misuse. And because of that, social workers need a complex set of tools with them. And SBIRT offers us a clear advantage in that it can be applied universally in direct practice. The evidence that supports SBIRT's effectiveness at reducing alcohol and substance misuse is also encouraging, and it's really an ideal tool for social workers who serve diverse client groups and do not necessarily specialize in substance misuse. So it also has this benefit of also benefiting addressing risky substance use rather than simply responding to dependence or heavy use in general. So I hope that was helpful. And if you have more questions about SBIRT, again, you can reach out to BSAS, the Bureau of Substance Addictive Services, to get your own manual, or you can access that online for free using the link that I provided for you. Or you can come talk to me, Dr. Taylor Hall in the Social Work Department. Thank you. Take care.